Hi, my name is Dr. Stephen Bacon. I'm a clinical psychologist, and I'm making this mini video as an introduction to the workshop that I'll be giving in England on therapeutic wizards and constructionism. And this little video is going to focus on the difference between constructionism and constructed reality. And there is quite a bit of difference. Constructionism has become very well known over the last 20 or 30 years. Pretty much any educated person is at least to some degree a constructionist. To understand that different cultures see reality in different ways, and that when everybody agrees with that way of seeing it, it appears as if what is constructed by a culture is actually real and permanent, but in actuality, it's just a construction. So, for example, the idea of sexual orientation might be a construction. What is femininity? What is honor? The good life? All those seem like they're solid answers from inside the culture, but if you look at them across cultures, we realize that each culture constructs its own version of that, and it only seems to be solid and as if it's the absolute last truth. So that's constructionism, or sometimes called social constructionism. Constructed reality is a similar concept, but has a completely different set of implications, especially for the therapist or the change agent. And I'm going to give you an example of people who are living in constructed reality so that you get a flavor for what I mean when I'm referring to that. So after World War II in the United States, a number of psychologists and psychiatrists, a few social workers, got interested in hypnosis. And they invented the concept of clinical hypnosis, which they contrasted with stage hypnosis or entertainment. Obviously, they were intrigued by the results that the stage hypnotists were getting, but they wanted to use it for healing. And so they learned how to put people into trances, and then they used it to treat depression, anxiety, personality disorders, you name it, they brought it to bear on all of those kind of things. Trauma especially was a really relevant topic. But to understand constructed reality, you have to try to imagine that you were one of those early pioneers in clinical hypnosis. When they were developing clinical hypnosis, many of those early pioneers thought they'd found a technique that was absolutely going to radically transform psychotherapy. They believed that if you put a person in a trance, there was virtually no limit on the way you could use that trance state to alter a person's inner world. And so they came up with various approaches and techniques. For example, they used ideomotor signaling. Ideomotor signaling is when you tell the person that their hand and fingers are paralyzed and they can't consciously move them, but their unconscious mind can raise their index finger if it wants to say yes, and their ring finger if they want to say no. And then the hypnotherapist would ask questions of the unconscious mind, like, how do you feel about the spouse? And what kinds of feelings lie at the basis of your anxiety disorder? And they felt they had a direct line into the unconscious mind, and they were getting information that was unfiltered by the conscious mind. Another example is they felt they could use hypnotic trance to have access to vast reservoirs of creativity and resourcefulness. For some of them, Milton Erickson made this particularly famous. They talked about recapitulating a child's mind with the ability to learn and be flexible and fluid and come up with many options. Other people would talk about trance leading to the inner wise person, so they could get answers from inner wisdom about what direction a person should go, what kind of healing they wanted, and so forth and so on. They believed that they could put somebody in trance and completely remove memories that were traumatic, or at least reduce their power so that they no longer functionally interfere. So they would do 1 and 2 session cures of trauma. They could sit there and tell people to look at their trauma differently, and instead of being negatively affected by it, turn it into a lesson. And just by inviting the person to see it that way in trance, they could transform that entire experience. What I'm trying to say is that the hypnotherapists, for about 10 or 15 years, when they were just coming into this, thought that there was no limits on what was possible. They thought they could do mind-body healing, maybe reverse cancer, certainly cure insomnia, stop pain, cure all sorts of different kinds of headaches and so forth and so on. The reason they believed this is they believed that hypnosis and the idea of being in a trance changed reality from being fixed and fundamental and solid into something that was fluid and amorphous. And that when a person was in trance, reality became fluid, and the hypnotherapist could go along as a guide, and in that fluid state, just make suggestions or access resources. And then when they came back to the real world be changed by the immersion. So that's an example of a constructed reality. Therapeutic wizards, to get the results that they get, 1 session cures, helping a lot of people that other therapists can't seem to touch, profound insights, generate epiphanies relatively easily, those kind of results that the wizards are famous for. The reason they get it is they figure out how to go into constructed reality themselves and how to bring their clients along with them. And that's something that the workshop is going to particularly pay attention to. So constructionism is simply the idea that different cultures construct reality differently. But living in constructed reality is the idea that you see reality as essentially fluid, not fixed, something that's amorphous and easy to change, just like the hypnotherapists did in the 50s and early 60s. I will leave you with that thought.